Assalamu alaikum. Today we will talk about the physiology of thyroid hormones. The functional unit of the thyroid gland is called follicles. So these are the follicles, which is composed of a simple cuboidal columnar cells. So these are one follicle, where these are the simple cuboidal columnar cells surrounding a center of colloid, which is rich in thyroglobulin protein. If you see here, it is also richly vascularized, and this is to secrete the thyroid glands into the circulation. Also, in these thyroid follicles, there is another hormone secreting cell called C cells, and this secrete hormone called calcitonin, which we will discuss it with the parathyroid gland because it controls the calcium metabolism similar to parathyroid hormones. Before we discuss the synthesis of thyroid hormones, I want to mention about iodine. Iodine is one of the trace elements which is essential and required for the formation of thyroid hormones. Iodides usually ingested from food and absorbed through the GIT tract. This chart shows you the most rich food with iodide, which is the dairy products, the egg, the beans, and the seafood, different fish or oysters and green seaweed, together with the pink Himalayan salt. But even now, to compensate for any deficiency in iodide, most of the salt in the market is added with iodide. That's why when you go to buy salt, better you take the one which is fortified with iodide, so to compensate for any deficiency in iodide in the food. So normally most of this iodide is excreted rapidly by the kidney, but here the follicular cells of the thyroid can selectively remove around fifth of this intake and trap it inside these follicular cells to be used for the thyroid hormone biosynthesis. The daily recommended of iodide intake is around 0.1 milligram per day. It's really small but very important. Otherwise, the synthesis of the thyroid hormone will not be able to be processed. So let's go through the different steps in the biosynthesis of thyroid hormone. The first stage is the transport of iodides from the blood into the follicular cells of the thyroid. So here is the blood, here is the basal membrane of the thyroid follicle. The basal membrane of the thyroid follicle contain pumps, iodide pumps, which they are calling sodium iodide symporter. So these pumps has a specific ability to pump the iodide from the blood into the follicular cells in a process called iodide trapping. And this step is strongly stimulated by the thyroid stimulating hormone, which is secreted by the anterior pituitary gland. In normal gland, under the normal physiological concentration of the TSH, it can concentrate the iodide up to 30 times higher than the plasma concentration. When there is a maximal stimulation of the thyroid gland, maybe because of high secretion of TSH, this can reach up to 250 times. Before we speak about the second stage, I want to give you some idea about the thyroglobulin. Thyroglobulin is a protein. If you see here that the endoplasmic reticulum and the Golgi apparatus inside the follicular cells produce or secrete this large glycoprotein, which is called thyroglobulin. This protein contains around 70 tyrosine amino acid, and these tyrosine amino acid are the major substrate that will combine with the iodide later on to form the thyroid hormone. So the thyroid hormone, basically this tyrosine with the iodide ions. So the second stage now here, we already trapped the iodide inside the follicular cells, and the thyroglobulin is produced by the Golgi apparatus of the follicular cells. Now the second stage, that this iodide should be oxidized, so oxidation of iodide ions, which is conversion of these iodide ions into the oxidized form of the iodine. So here the iodide ions will be transported here through these carriers called benderine in exchange of chloride, and with the action of peroxidase and hydrogen peroxide, it will be converted to the oxidized form. So if there is any drug or any pathology that block this peroxidase, there will be no oxidation of the iodide ions, and this will stop the synthesis of thyroid hormones, because now the iodide cannot couple with the thyroglobulin to form the thyroid hormones. So now here the third stage, now it's the iodination of the tyrosine. So the binding of this is the thyroglobulin, and this is the tyrosine amino acid. Now the combination of the tyrosine with the iodide, which we call it the iodination of tyrosine, if only one molecule of iodide, it will form monoiodotyrosine. If two iodide combined with tyrosine, it's called diiodotyrosine. Now the fourth stage is coupling of this mono and diiodotyrosine. So if there is a coupling of two diiodotyrosine, then a T4 will be formed, which is tetraiodotyrosine, or the second name for it called thyroxine. If one diiodotyrosine and one monoiodotyrosine combine together, it will form tetraiodotyrosine, which is the T3. Okay, so now T4 and T3 is formed. Now, after the synthesis of these T3 and T4, which is inside the thyroglobulin, each one molecule of thyroglobulin will contain around 30 thyroxine molecule T4 and very few triiodo T3 molecules, and in this form they will be stored here. It will be stored in the follicle in an amount sufficient to supply around 2 to 3 months. So if there is any deficiency, the symptoms will not appear unless after 2-3 months, because enough amount of it will be stored already inside the follicle. Here in the colloid, this in the central part, a lot of these thyroid hormones are stored here. So the last stage of biosynthesis is the release of these T3 and T4 hormones from the thyroid gland into the circulation. So now we are speaking about this stage. So the first thing will happen is the formation of these pinocytic vesicles that contain droplets of this thyroglobulin. Then these colloid droplets will combine with the lysosomes inside the follicular cells, and these lysosomes contain different proteins like proteases that will go and digest the thyroglobulin and release the free T3 and T4, which then they will diffuse through the basal membrane of the follicular cells into the surrounding capillaries and then into the circulation. 93% of the hormones released from the thyroid follicles is T4 and only 7% T3. Okay, so this is what will be released from the follicular cells. Within few days in the circulation, the T4 will be deionized. One iodide ion will be removed and it will be converted to T3. So most of the T4 will be converted to T3. And this is important because the final hormone which will affect on the receptors, most of it is in the form of T3. That's why most of the T4 in the circulation will be deiodinated. Now, these thyroid hormones will be there in the circulation. How it will be transported? T4 and T3 are transported attached to plasma protein. There are 3 plasma proteins which carry the thyroid hormones: thyroid binding globulin, thyroid binding prealbumin, and thyroxine binding albumin. So these 3 carriers for the thyroid hormones. Almost 99.9% of the thyroid hormone released is bound to protein, and only very little amount, which is around 0.03 of T4 and 0.3% of T3, are found free in the circulation. And this is the free, the unbound form is the one which has the metabolic activity and can bind to the receptors and cause the physiological effects. What about the onset and duration of action of these thyroid hormones? These thyroid hormones, especially the T4, has a high affinity for plasma binding proteins. That's why they are released to the tissue very slowly. And this is another factor which makes them to be found in the circulation for longer period of time. That's why if there is any deficiency, it will take a longer time to appear on the person. The half-life of the thyroxine, because of this binding, high affinity binding, is around 6 days, while for the T3 is only 1 day because it has lower affinity to these proteins compared to thyroxine. Again, for the same reason, T4 has a slower onset of action of around 2 to 3 days. It peaks around 10 days, and it will take around 40 to 5 days to reduce back to reduce over the next 40 to 50 days. So it is really taking longer time in the circulation. And this is again because of the high affinity and firm binding with the transport proteins. T3, because it has lower affinity and which bound more weakly to these proteins, they have much faster action and little bit shorter half-life and shorter onset of action. What is the mechanism of action of thyroid hormones? As you already know that these thyroid hormones are lipophilic hormones, so their receptors located in the nucleus, so they have a nuclear receptors. Again, before acting on these receptors, there will be deiodination of the T4. So the T4 will be converted into T3 because this is the one which will bind to the receptors. Because these receptors has higher affinity for T3. That's why more than 90% of the thyroid hormones that bind to these receptors is T3. Again, because of the same reasons, because this T3 have less affinity to these carrier proteins and they can have also a very quick reaction with these thyroid receptors. So the mechanism of action that they will stimulate or they will activate nuclear transcription of different genes that will produce messenger RNA and will produce new proteins, and these new proteins will have the functional activity of the thyroid hormones that spread throughout the body. So it's mainly through production of new proteins, which can be enzymes, can be carriers, can be different things that cause different actions in the body, as we will see that the thyroid hormone have functions in almost all the body functions. So maybe here, because now we will speak about the functions, as I told you, it acts on almost all the tissues of the body. So if you want to take a break 5 minutes, have something to eat or something before we go through these actions, because sorry for that, but it is a long a long talk, and you should know it. The first action of the thyroid gland is they increase the cellular metabolic activity of the body. It increases the number and the activity of mitochondria, which will increase the energy formation and which is required for the cellular energy formation. It increases the active transport of ions throughout cell membrane, so like sodium, potassium pumps and different pumps. And it increases the amount of heat production in the body. That's why we call these thyroid hormones are calorogenic, because it increases the energy formation. And when you produce energy, you also produce heat. It increases the basic metabolic rate. So high thyroid hormones will increase the metabolic rate from 60 to 100% above the normal. That's why patients who have high thyroid hormone formation, they will complain of heat intolerance. They feel that hot most of the time. They are feeling hot, they are feeling sweating, and they cannot tolerate the temperature. And the opposite happen when in hypothyroid patient, their basal metabolic rate will fall almost to half, and they will feel cold. The other effect, an important effect of thyroid hormones, is its effect on growth. Similar to growth hormone, it is very important for the normal growth and development of the body through stimulation of protein synthesis in the cells that will promote growth. Here in patient or in kids who have high thyroid hormone secretion, this at the initial stages it will stimulate the rapid growth of the body, but it will cause early closure of epiphyses, bones epiphyses, which are responsible for the elongation of the bones. So they will close early. That's why the final stature may be shorter, that they call them thyroid dwarf, similar to what is happening with growth hormone deficiency. Another very important function of the thyroid hormone is the effect on the development of brain in children. So it is very important for brain development during the fetal life and the first few years of postnatal life. Without the thyroid hormone, the brain will not be developed, and these poor kids, they will have mental deficiency, and they will have something called mental retardation cretinism. That's why early diagnosis of any thyroid deficiency during childhood is a must. That's why now here in Oman, screening at birth is a regular for all kids to look for the thyroid hormone levels, because if they diagnose it very early, it can be treated and the kids can develop normally mentally, This is a picture of an adult with congenital thyroid hormone deficiency. So if you can notice here, it's a short stature, thyroid dwarf, and if you talk to him, you will realize that he has mental retardation cretinism, because thyroid hormones deficiency during early years of childhood will affect the brain development. What about the effect of thyroid hormone on different nutrient metabolisms? If you recall that the thyroid hormone increases the overall metabolism of the body, which means it needs substrate for this energy production. So here it will stimulate the carbohydrate metabolism. It will cause rapid uptake of the glucose by the cells. It will cause enhanced glycolysis. It will enhance gluconeogenesis in an attempt to provide energy for the cells. It increases the rate of absorption of the carbohydrate from gastrointestinal tract. It increases insulin secretion, which will result in the different functions of insulin. And this is all will increase the carbohydrate metabolism, which will be required to produce energy, because the whole metabolism of the body will be increased by the thyroid. What about the effect of thyroid on fat? Similar thing. There will be an increase in fat metabolism. The lipids are mobilized from the fat tissue, which will decrease the fat stores of the body, and it will increase the free fatty acid concentration because of this lipolysis, and it will accelerate the oxidation of these free fatty acids again to produce more energy. So now here people who have high thyroid hormones, they will reduce weight because of this there will be the fats will be reduced, the fat stores will be reduced and utilized for energy production. What about the effect of the thyroid on the plasma and liver fat? Okay, so that what we talked about is the fat stores. What about the plasma here? If there is an increase in the thyroid hormone formation, there will be a decrease of cholesterol, phospholipids, and triglyceride. And why is that? Because here the thyroid hormones will stimulate the bile acid formation. So bile, if you recall from your GIT tract, one of the components of the bile is cholesterol. So if there is more of bile acid formation, there will be more of fecal excretion of cholesterol. Also, this will stimulate steroid synthesis in adrenal cortex and gonads, because most of the hormones from adrenal cortex and gonads using cholesterol in their biosynthesis. Also, in the liver, there will be increase in the formation of LDL receptors. And these LDL receptors then will remove any cholesterol from the circulation. So all these mechanisms will result in low cholesterol, phospholipid, and triglyceride in the plasma. What about when we have a decreased thyroid hormone secretion? The opposite will happen. When a patient who have a low thyroid, like hypothyroidism, they will be presented with increase in plasma concentration of cholesterol, phospholipids, and triglycerides, which also will cause deposition of these fats in the liver and cause them fatty liver. What about the effect of thyroid hormone vitamins? It will increase the whole metabolism of the body, so it means it will increase the requirement for vitamins. So the increased requirement for vitamins because of increased bodily enzymes activity, which will use these vitamins as a coenzymes or cofactors. So with patients who have a high thyroid hormones, if their diet is deficient in vitamins, they might have vitamin deficiency unless they have supplements. What about the effect on thyroid hormone? I already mentioned it. It's the high decreased body weight. So patients who have high thyroid hormones, they will have reduced body weight, and the opposite have when they have low thyroid hormones, they have high body weight because of increase in fat store and increase in the decrease in the basal metabolic rate and decrease in their metabolism. So even some ladies now, which is not recommending, they use thyroxine to reduce their body weight. What about the effect of thyroid hormones on cardiovascular system? Just I want you to spend a minute think about what will be the effect on cardiovascular system. What we said, that the thyroid hormone will increase the metabolism of all cells of the body. So what will happen when the metabolism increased? How it will affect the cardiovascular system? There will be increase in blood flow and cardiac output. Increased metabolism in the tissue will cause more utilization of oxygen, and there will be more of metabolic end products. And these metabolic end products, what they will do, they will cause vasodilatation, which will increase the blood flow to these metabolically active tissue. When we increase the blood flow, and also because of the production of the heat, also there will be a vasodilatory effect in the skin to eliminate the heat. All this will increase the blood flow. As a consequence of increasing blood flow, there will be an increase in cardiac output. Okay? What about the heart rate? The thyroid hormones have chronotropic effect, which means increase in the heart rate. And this is through a direct effect on the SA node, which will increase the excitability of the heart. And this effect is very important clinically because it will guide the clinicians to diagnose any abnormality in thyroid hormone function. So patients who have a high thyroid hormones, what we call hyperthyroidism, their heart rate will be increased, what we call it tachycardia. And not on, and the most sensitive sign is called sleeping tachycardia. Usually when you sleep, your heart rate will be reduced because of the vagal tone is more. But patients who have high thyroid hormones, they will have tachycardia even when they are asleep. Patients who have low thyroid hormone formation, they will have bradycardia. What about the strength of the contraction of the heart? Again, so it has a chronotropic, also it has an inotropic effect, which increase the strength of contractility of the heart muscle. And this is all because of the increased enzymatic activity by the thyroid hormones. So only increase in the strength of the heart only when a very slight excess of thyroid hormone is there. However, when thyroid hormone is increased markedly and also for longer time, it's not good for the heart muscle because it will cause depression of the heart muscle, and this is all because of increase in protein catabolism in the heart muscle. And these patients may have cardiomyopathy, and because of two reasons: because of this increased inotropic effect and protein catabolism and the decompensation of the heart muscle, and also because of the increased cardiac load. So there will be too much pressure on the heart muscle, and which might fail at the end if not treated properly. What about arterial pressure? Can you tell me? Just again, spend 1 minute to think what will be the effect of thyroid hormones on the arterial pressure. Is it normal, high, low? The mean arterial pressure usually remains about the normal, so there will be normal blood pressure. But the pulse pressure is increased. Why is that? Why the pulse? What is pulse pressure? Why it is increased? Because when there is increase in cardiac output, there will be increase in the systolic blood pressure. And because of peripheral vasodilatation, there will be a decrease in diastolic blood pressure. That's why the pulse pressure will be increased and wide. What about the effect on respiration? Again, keep in your mind what increased body metabolism, what will cause on your respiratory system. So there will be increase in respiration. Increased metabolism will increase utilization of oxygen and more of formation of carbon dioxide. And this will stimulate your respiratory center to increase both the rate and the depth of your respiration. And don't forget, also the heat production is another stimulus for respiratory center to increase the respiration. Also, because the body now needs more of oxygen, there will be an increase in 2,3-diphosphoglycerate, which will increase the dissociation of oxygen from the hemoglobin. What about the GIT tract? Again, there will be an increase in metabolism, increase in the energy produced, so the requirement of the body will be increased, and this will be by increasing the appetite, increase in the food intake. So patient who come with high thyroid function, they will tell you, I'm hungry all the time, I want to eat, I have a very good appetite, something like that. Increase the rate of secretion of the digestive juices too, so more of food will be digested and reabsorbed. Increase the motility of the gastrointestinal tract. That's why patients who have a hyperthyroidism, they often complain of diarrhea, while the opposite happens when in patients with hypothyroidism, they will complain of constipation because the motility of the gut will be reduced. What about the central nervous system? Again, thyroid causes excitation of the central nervous system. Thyroid hormone increase the rapidity of cerebration, which is the use of the brain and the thinking and all these functions. And any lack of thyroid hormones will reduce this function. That's why patients with hyperthyroidism, they will be nervous, they will have some psychotic tendencies like anxiety, worry, paranoia, and if you check their reflexes, they will have a hyperreflexia. The opposite happens with hypothyroidism. And we are speaking here during the adult period, because during the childhood it will form the cretinism, yeah? But in adulthood they will have a decrease in mental function, and also if you check their reflexes it will be hyporeflexia. Decrease in mental function, they will be like slow, they don't react with you, and then sometimes you might feel them dumb. What about the muscles? The same thing. Any slight increase in thyroid hormones will cause the muscle to react very strongly. And in patients with hyperthyroidism, because there will be increased stimulation of the muscles and the metabolism, there will be excess of protein catabolism, and the muscles will become weak. In hypothyroidism, the muscles become sluggish. They are very relaxed. They relax slowly after contraction, so they take longer time to relax after contraction. What about other endocrine cells? It will increase the need for other hormones because of the increase in metabolism. So there will be the secretion from other endocrine glands like insulin, parathyroid hormones, adrenocorticotropic hormone, glucocorticoids, all these will be increased. What about the sleep? Patients who have a hypersecretion, they will have disturbed sleep. They will complain that they cannot sleep properly at night, what we call it insomnia. The opposite happens with hyposecretion. They always will feel fatigue and they want to sleep even during the time, what we call it daytime sleepiness. The gonads. So as I told you, the thyroid hormone affects the whole body, and it is required for most of the functions of the body. So thyroid hormones is very important for the development and function of the gonads, either in the males or in the females. In the females, any disturbance of the thyroid hormone level will cause menstrual disturbances. Either it will cause excessive bleeding, infrequent menses, or even either they stop for longer time or they're coming frequently, so they will it will disturb the menstrual period. For males, the hypothyroids will cause decrease in the libido, which is the sexual drive, and in cases of high thyroid hormone secretion, it will cause impotence. So a proper history from a patient is needed to see what is the effect of this hormonal level on the person. What about the bone marrow? So also it has an effect on the bone marrow. It again increase the metabolism and erythropoiesis. It also very important in the absorption of vitamin B12. That's why patients who have hyposecretion or hypothyroidism, they will have anemia, and it is of megaloblastic type because of vitamin B12 deficiency. How these thyroid hormones are regulated to a normal level? It uses the classic feedback loop that involves the pituitary and hypothalamic axis. Before we speak about that hypothalamic pituitary axis, let's talk about the thyroid stimulating hormone. It is a glycoprotein and secreted from the basophilic cells of the anterior pituitary gland. So basically, thyroid stimulating hormone, I mentioned it earlier, it increases the secretory activities of the thyroid glands. It stimulates the iodine pump. It supports the follicular cells. It breaks down thyroglobulin so to release more of thyroid hormones. It also stimulates the iodination of tyrosine. So it basically stimulates all the process of thyroid hormone biosynthesis. And the mechanism of action is through the adenyl cyclase system. So if you see here, the hypothalamus is releasing a thyroid releasing hormone which will affect the anterior pituitary gland to secrete thyroid stimulating hormone, which will go and affect the thyroid glands to secrete more of T4 and T3. So the level of T4 and T3 will control the other hormones. Also, the hypothalamus, not only the level of T4 and T3, or the other factors as we discussed before, so like cold environment, any stress, emotional or physical, the circadian rhythm of the body, all these affect the hypothalamus and affect the secretions of the TRH and TSH. So as I told you, the level of T4 and T3, it will have a negative feedback or inhibition on the pituitary gland and also on the hypothalamus. Say for example, cases of hyperthyroidism. Let's see any problem in the thyroid gland, say for example thyroid tumor. And this tumor will secrete more of T3 and T4. So the level of T3 and T4 will be increased. This will send negative feedback inhibition on the anterior pituitary. So what will be the level of TSH? It will be reduced. What will be the level of TRH? It will be reduced because too much of T3 and T4 is secreted, and now the body wants to reduce it back to normal physiological concentration. Okay, let's see, there is some other problem in the thyroid gland. They cannot produce T3 and T4. So the level of T3 and T4 is reduced. And this will send impulses to the anterior pituitary gland. What will happen to the level of TSH? Is it increased or decreased? It will be increased. And the TRH will be increased because now the body cannot produce T3 and T4. So it needs more stimulation. So more of TSH will come to stimulate the T3 and T4. Okay? What are the different disorders affecting the thyroid function? The hypofunction, which we call it hypothyroidism, so either during childhood because of congenital defect in the thyroid or congenital agenesis of the thyroid gland, and as I told you, this should be screened to avoid development of cretinism in these poor kids. In adults, it can cause a condition called myxedema, and also it can be because of colloid goiter, either due to iodine deficiency. I will not speak about what are the signs and symptoms here because I've already mentioned them while I was speaking about the function of the thyroid. So it's another homework for you to list how the patient will be presented with you if he has hypothyroidism. The other disorder that might affect the thyroid gland is the increase in function, what we call it thyrotoxicosis. One of the diseases that cause thyrotoxicosis, which is increase in the T3 and T4, is Graves' disease. And it is an autoimmune disease here. And I think you should go and read about it. What will cause the increase in T3 and T4 formation? Also thyroid adenoma, which is adenoma, a tumor in the thyroid that produce a lot of T3 and T4. We came to the end of this lecture. Thank you very much. And if you have any question, don't hesitate to send to me. Thank you very much.